Good afternoon, everybody. Welcome. I'm Justine, Forsyth, the CEO of Save the Children. It's a great pleasure to be co-hosting this event today with the Gates Foundation and DFID. And it's a very important topic, and we're going to hear in a minute from our very important panelists. We have the Secretary of State for International Development, Justine Greening. We have Melinda Gates, who needs no introduction. We have Tewodros Melesse, who's the Director General of Planned Parenthood. And we have Catherine Ojo, who's come from Nigeria and is a chief nurse in a training hospital in the north of Nigeria and a midwife. And we also have, hosting the panel, Natasha Kaplinsky, who's going to help make this an exciting and energetic event. I just wanted to say a couple of words before handing over to Natasha. This is a very critical moment for our cause, and in particular for the challenge of gender inequality. We've made, in the last few years, enormous progress under the auspices of the Millennium Development Goals in cutting the number of child deaths, in reducing maternal mortality, in getting children into school. I think just a few days ago, the Lancet study showed that I think there's been a 48% reduction in child deaths since 1990, and that's accelerated in recent years. But we know we won't make that level of progress going forward to 2015, the end of the Millennium Development Goals, and if we then go further than the Millennium Development Goals with a post-2015 framework to end some of these challenges of our time, to end child deaths, to get all children into school with a good quality education, to end maternal mortality, we won't get to that next stage, let alone achieving the Millennium Development Goals, unless we address this issue around gender inequality. And that means we need new strategies. We need to take on some tough issues, as the Secretary of State is doing with the upcoming Girls Summit, and as Melinda Gates did 2 years ago with the Family Planning Summit, which she co-hosted with David Cameron. So there's no more important issue than the one we're discussing today. At that summit that Melinda hosted a few years ago on family planning, there was, and I don't know if you remember this, Melinda, there was a young woman that came from Ethiopia. She was 16 years old. She was called, I think the picture might even come up, she was called Azalef. And she was a very impressive young woman. She ran her own football team in Addis, this is her picture. And she campaigned through football, but also the organization she helped run, a girls' organization in Addis, to combat early marriage, violence against girls. And she met Melinda, and she also met the Prime Minister, and the Prime Minister was very impressed, and in his speech he said about Azalef, "She has hope in her eyes, she has ambition in her voice, she gives you that sense she believes things can really change." And I was blown away, to be honest, by this young woman. And I kept in contact with her, and the organization did, when she went back to Ethiopia. And I suppose that's why I was so shocked that she returned to Ethiopia. And almost immediately, she had a very difficult choice in her life. Her family wanted to marry her immediately into an early marriage, even though she was a young campaigner against early marriage, or she was offered the opportunity to go and be a maid in Dubai. I mean, and thankfully to the Save the Children team on the ground, we helped change that story of her life, and we helped her go to education, and she's actually working for Save the Children now in our offices. But Azalef is just the tip of the iceberg, and many girls and women around the world face those choices. We know in Ethiopia that 31% of girls under 15 get married early. We know that 57% of girls, I think that's over 26 million, face female genital mutilation. We know that only 1 in 10 of girls and women give birth with a midwife. And that's why this event today, the Girls' Summit, the follow-through from the Family Planning Summit, making sure that we put gender at the heart of the next post-2015 framework, making sure tomorrow at the World Health Assembly we agree a plan of action that makes sure that every mother that gives birth has a midwife with them. There are 40 million women in the world who give birth often in the bush or alone. That plan of action that combines the Girls' Summit, the Addressing Early Marriage, female genital mutilation, all combined is the action plan that we need taking forward. And that's why we're so delighted to have the panel we have today, because these are real experts in these issues, campaigners, activists, but also the Secretary of State who's really shown the way on these issues. So Natasha.
Justine, thank you very much. A very big welcome from me too. And thank you very much indeed for your attendance. I know how busy most of your diaries must be. We have a lot to get through and a very limited amount of time. I don't intend to take up much of that time talking about myself, but simply to facilitate the conversation, to ensure that as many of you get a chance to ask a question if we have time for it, but certainly that you leave this room feeling like you really have been involved in a very robust look at the issues that face us. I've travelled widely with Save the Children, and I just want to tell you two very quick stories. The first was in India with Justine, where I had actually just recently given birth myself, and I was in what was supposed to be the best place in the part of the country that we were in to give birth, and I watched this woman labouring, and it was just absolutely dreadful in comparison to the experience I had had, the facilities, the help that was available, and this was the good place. And what struck me the most about that birth was she gave birth to a little baby girl, and she was absolutely gutted. And so that was the first point I wanted to raise with you. And secondly, I've just recently come back from the refugee camps in and around Syria, in Jordan specifically, and Zaatari, and looked at the overspill really of some of the refugees in Amman. Went to see one particular girls group who were really extraordinary, but what I was struck most about was the flattened and crushed hopes that they had, really, of a whole generation of young, vibrant, educated and wonderful young girls, and aware of the real jeopardy that their life had in front of them, and how fragile their futures really were, which should not be the case for any young girl or woman anywhere in the world. On a more positive note, I've also seen that real change is possible, and what a crucial role women and girls have in the future. So although we are at a point of crisis, there is real hope, and 2014 does feel like we really could be on the cusp of changing things. And with all of your help and with the panellists, we're hoping that we're going to kickstart that today. So I will be coming to your questions shortly. But first of all, let's hear from all of our panellists, starting please with Justine Greening, Secretary of State for International Development. 2014, the UK hosted, as Justine just alluded to, the Summit on Family Planning. There is a golden moment coming up, the Girls' Summit, in a couple of months' time. How hopeful, how optimistic are you that things really can change, that we can set the agenda?
I am optimistic, and I think that we won't see any change unless we continue to keep on winning this battle to improve the prospects and the rights for girls and women. And we really put a stake in the ground 2 years ago, and it's fantastic for Melinda Gates to be here, and thank you for all of the leadership that you've shown on this role. When in 2012 we did the Family Planning Summit, and that was all about saying that between then and 2020 we'd make sure that 120 million women and girls had access to family planning who otherwise wouldn't have done. And I think, speaking as a woman, I think we all understand that it's one of the most basic choices and rights that a girl or a woman can have, which is when and how many children to have. And we know that when women and girls have that choice, they tend to space out their children, that their children are healthier, they have them later. But it does tie into a whole load of other issues, as Justine talked about, around female genital mutilation, child early and forced marriage, issues of education, and therefore this issue of women and girls has really now become a central part of what DFID is working on, because we think it's so intrinsically linked to successful and sustainable development. And I think we see also that even when we're successful, it's a challenge. The girls in Nigeria were really one of the success stories of the MDGs. These were the girls who'd gone through primary school, they'd gone through secondary school, and their parents had got them into secondary school and supported them there, and clearly have a plan for those girls that was about them becoming the women that they could be. And even then, and Malala found out, there's a challenge. So we need to keep fighting this battle, and certainly the UK will play our role in making sure that we are part of one of those countries that adds to the momentum and supports the countries around the world that are working so hard on this.
The UK government currently taking part in discussions at the World Health Association. What commitment can you make to making sure that the women that I met in India and all those like her do have birth attendants? Just to address that issue specifically, that 1 million children, babies, do not die on the first day of their life. There needs to be a commitment from the government.
Absolutely, and we're making that commitment to support this Every Newborn Action Plan. I think we've seen a tremendous step forward in the reduction of newborn children dying, and indeed early mortality in under fives. But there's a very, very long way to go. And we know that alongside that, we need to make sure that there's a broader health system that can help them grow up healthy in terms of nutrition, in terms of vaccination, and that's why the work that the UK does with the Gates Foundation on Gavi is so important. And then latterly, as I talked about, making sure that when these children get to an age where they can go to school, we start to develop them in terms of their overall human potential to not only grow up healthy, but to be people who can play a productive role in their communities and their societies and help their country develop.
Okay, thank you very much. Melinda Gates, first of all, I'm going to just break in proceedings for a moment and just say Melinda received her DBE this morning, so do you think we should give her a round of applause? So richly deserved for everything that you've done, and you clearly are a massive draw for all of us today, so thank you very much for creating time in your extremely busy life. You are a real champion, really, of lots of things, but specifically family planning. Why is this whole moment now, why this year, is it so important for all of us to commit to the issues that you highlight so eloquently?
Well, I think we need to think about women and children and the continuum of their lives and how they lead their lives in these countries. And when I see the progress that has been made because of the commitment by the UK government, the governments of Europe, the African governments of their own budgets these days, we are making huge progress in development. The fact that we've almost halved child mortality, that is under 5 mortality since 1990, we've almost halved maternal mortality. It gives us a view of where we can go. So if you think about a woman in the 1980s in the UK, you didn't think, from 1980 and beyond, when a woman goes into the hospital here to have a baby, you don't wish her well, like she might die or her newborn might die. We can start to look at that future now for Africa because childhood mortality's come down so much, because we're finally getting out family planning, contraceptive to women, not in the volume we need. Our goal is 120 million new women access to contraceptives by 2020. But if women can plan and space their births, it's healthier for them, they don't die in childbirth, and it's healthier for that newborn. So I was just at the World Health Assembly announcing this early newborn action plan. And when you look at the under 5 mortality and how steeply it's come down, the one piece where we haven't really tackled childhood mortality are these newborns, the first month of life. We lose 2.9 million of them in the first month, 1 million on the first day in life. And yet the ways that you intervene are actually quite simple. And using these community health workers that Justine talked about, who are there and attend the birth, just doing some simple things like teaching the mom to keep the baby warm and to dry the baby, teaching her to immediately and exclusively breastfeed. Those cultural practices at the moment of birth save lives. And so for me, it's that continuum of how do you keep mothers and newborns healthy, so then we can start to make sure that these women and children grow up to have healthy lives.
To ask you a similar question to Justine about how optimistic you feel. I mean, do you feel that this is the moment, this is the year that women and girls can come to the fore?
Absolutely. And I think the development community has really been leading up to this the last few years. There's been a lot of talk in the community. We're actually doing programming already, I think, around women and girls. But I think this is our moment to finally highlight and to say, because we've made progress on maternal deaths and childhood deaths, we can now start to surround that work with other pieces that we always have known have been there for women and girls, but now we have a chance to actually tackle them, because you've got to work on girls and women's agency so they can grow up and get an education and have some means of income. They will lift themselves out of poverty. It's their business to do that, but we can help them along the way with these various interventions.
Okay, thank you very much indeed, Melinda. Catherine, to you next. You are at the coalface. I mean, you're probably the person that we need to ask most of the questions to, because you are confronting these issues day in, day out. What would you highlight are the main issues that the women and girls that you help deal with?
Thank you very much. I feel highly honored to be part of this panel, especially among the people who are making things to happen globally. So I want to say that my role as a nurse midwife and a technocrat working on the field, you know, are so enormous, especially in helping women and girls all over the world. I want to say that I teach girls and women to embrace family planning so that they can have babies by choice, not by chance. I also promote female education, because a woman who is educated, the baby has about 10 chances of living than a woman who is not educated at all. I also try to ensure that safe delivery for both mothers and their babies, and immediate newborn care, which is needed, you know, to make all these babies survive. And that is why in my environment where people, less than 50% of women still go to still deliver with skilled birth attendants who cannot take care of the immediate newborn care. They may succeed in assisting the woman, but what about the baby? And so that is giving rise to mortality in newborn. Then regarding the issue on female genital mutilation, this is a devastating effect on women, especially in the environment where I come from. Women have this genital mutilation done either during delivery, when they go to the traditional birth attendants, because they believe that if they are not circumcised, the baby may die. They also believe that a woman will be competing with her husband because they see the clitoris like a penis. So the best thing is to cut it off. And unfortunately, when they cut it off, they leave these women devastated, emotionally traumatized. These women cannot enjoy sex. Their husband abandoned them. And unfortunately, some of them may not be economically empowered. So when you throw a woman out who is not economically empowered, what happens to her? She's prone to a series of infections. She's prone to even mental disorder. And they cannot be useful in the society. So it is very, very devastating and pathetic when I hear about genital mutilation. I want to share one little story about a baby who was delivered, and 8 days after, the grandmother came from the village and said, oh, this baby must have this genital mutilation done immediately, because they don't usually have pains when they are babies. Who say that? But because of their ignorance, that was how the mutilation was done for this baby. And the grandmother again now said, oh, I better back this baby so that she can keep warm on my back and the healing can take place. You know what happened to this baby? This baby bled to death at the back of this woman. She felt wetness. She thought the baby only passed urine. By the time she brought this baby down, the baby had lost all the blood in him. Why must we waste babies' lives? Why must we waste women's life or even girls' life just because of a harmful practice that is detrimental to their health? Another issue I'd like to say again is on the maternal mothers and their newborn. You know, I've already said it that less than 50% deliver with skilled birth attendants, though it varies in different areas in Nigeria. But I still want to say that We midwives, we are still at the forefront to assist them if we are well skilled, we are well supported and well trained to recognize danger signs, to know what to do at every point. I remembered a woman in my own community who came to meet me. After having gone, she was 7 months pregnant, and she went to a poor resource setting where she actually, she had ruptured membrane. So when she got there, the doctor told her that she should go and have bed rest at home. But she didn't feel comfortable. She still came to meet me to ask for my wise counsel about the issue. Then I told her, I said, look, you are prone to infection, your baby is prone to infection. And I would just suggest that I give you a letter now to go to a bigger hospital where you can be better attended to. Because in my hospital, that's a tertiary institution in the northern Nigeria, that we will confine you to bed. So that was how she was referred to that hospital. And she got there and she was confined to bed, she was treated, she got okay. She had postpartum hemorrhage after the delivery, but after we were able to resuscitate her.
Sadly, Catherine, I'm sure that you can tell us hundreds of stories like that, but what it sounds like you're saying, underpinning everything is about education, whether it's family planning or FMG, any of the issues that we face. We'll be coming back to you later, but let's just bring Tewodros in. I gather you face similar issues, but particularly in Asia. Can you outline some of the issues that you work with daily?
Yeah, for us, since FE 2020 commitment in July 2020, 2012, going towards 2020. Our objective really is to triple the family planning services that we are providing. We are on track. We are almost doubling by 2015. From 112 million in 2012, now we have reached 136 million. Of course, Asia is, with its diversity and the many women, India constitutes a population of, very high, the inequality that it is. What we have managed to do in India, for example, is working with young people and also working with the government. The Indian government committed itself to our association $8 million to be part of the partnership, and I'm thankful for DFID is one of our major donors for that. So, working in partnership with the government and selected states is a very critical area. We are also partnering with UNFPA. So what we are dealing in the situation in India is that although there is a commitment of the government, we want to ensure that the choice of contraceptives is ensured, that it's not only sterilization or permanent methods, but the variety of the choices that it is. The violence against women. I'm sure you have heard all the news about women being raped in transportation, which has come into the highlight. Our association and our regional office there, we work in advocating and making sure that gender-based violence is eliminated, and that's our major work also in Syria and in conflict zones, and also in the Pacific, where gender-based violence is a very serious issue. So we try to link up that. And the adolescent issue, when we are talking about the majority of the population today, which is coming up, is young people. And if we don't address the need of the adolescents, we have not addressed it. Okay. We have a full circle approach, a full life circle approach that is, we're not a vending machine where we just say the pills are there or the contraceptives are there. We care also about the comprehensive sexual education in schools, out of school, with peer educators, and then encouraging girls. For us, Malala is a hero in Pakistan, where we are working with parliamentarians and with young women. And it's important to engage young leaders. So that's really what we are working in, moving and working with young people, with religious leaders, because religious leaders are also important. What we do in Bangladesh with religious leaders to talk about gender equality, girls' education, the need for family planning. Even in a conflict situation like Afghanistan, we are doing the work and we have the commitment of the government and the religious community.
Okay, thank you very much. We'll pick up on two of those issues with Melinda in a minute about disempowerment of women. But Justine, just to talk a little bit more about FGM, I mean, what we're talking about now is overcoming practices and traditions that are so deeply entrenched in different societies. How possible is it really to overturn those?
I think it is possible, but it's complex, and we know that in different countries the drivers come from different mechanisms. So for sometimes it's economic, sometimes it's tradition, sometimes there's a so-called religious aspect of it which isn't actually real. And so what you need is a tailored approach. And actually, if you talk to the Minister for Women in Ethiopia, which is a country which has done a lot of work on FGM, and actually one of the key strands of success that came out of everything that people were saying just now is political leadership, and countries owning the strategy about how you move forward. And in a country like Ethiopia, they've done lots of work on both child marriage and also FGM, and what they've done is put the right laws in place at the national level and funding that's then been backed up with donors, and DFID is one of those partners that work with Ethiopia. We've then seen at districts and at the regional level work done. We've reached out to community leaders, to religious leaders, and to grassroots communities, and actually the key to success, and the reason why it's hard to get success, is to have this comprehensive, holistic approach that means you look at all the aspects of the issue and work on them together in a joined-up way. That makes it challenging to do, but actually the lessons when you look at places like Ethiopia, I think Burkina Faso is another country that's done a lot of work on this, is change can happen quite quickly. So you can have generational change. And actually some of the most passionate campaigners in this area are young people themselves, all around the world in the countries concerned. But I mean also here in the UK, we shouldn't pretend that we don't have issues on FGM, on child and early forced marriage. Our forced marriage unit is set up precisely to deal with those sorts of issues. So the Girls' Summit this year will provide a chance for us to really galvanise momentum around FGM, around child and early forced marriage, for the UK itself to look at what more we can do here, and other countries around the world, what more they can do to really make sure that we get the momentum behind this that we need. And we do think we can make progress, but we think we need to tackle these issues sensitively, and you need a tailored approach. And the Ethiopian Women's Minister literally had to work with 85 different ethnic tribes within Ethiopia to get progress on the ground, and that was a highly complex approach. But actually, with care, thought and attention, you can absolutely make progress. That's the good news about this.
Melinda, broadening it out, I mean, the disempowerment of women and girls is so deeply ingrained, really. How hopeful are you that that can change?
I think it absolutely can change. I mean, you need to look at what gets societies to move forward. Our own countries have had problems in the past around women and girls. And as Justine said, we're not completely there yet in any of our own countries, right? We all have issues. But I think part of getting societies to move forward is to create awareness about the issue, is to create, as she said, political leadership. And quite honestly, it takes policy and laws in place, but that's not nearly enough. Then you have to get the groundswell of movement that says, we're not going to allow this as our own community. You have to get men and women to stand up together with boys and girls to say, we believe in not having violence in our community, and we will report it. We believe in getting our women to a community health worker or to a health post to deliver her baby. And by the way, we're going to set aside transport resources to do that, money to be able to call the ambulance or the cab. We believe in getting our girls into school, and we're going to advocate to the government to have a school building built in our area. You get that cultural change when you create the awareness and people publicly talk about these issues and commit to them, and then there are the laws that are there to back it. And I think it's absolutely possible. I think we have to look at how societies move forward and how we've gotten change in our own and take some of that to these places so that they can learn as quickly. But again, it absolutely has to be from the ground up. It has to be, if it's an African country, they've got to decide they want to do it themselves. We can help nudge it, but they really have to take on this cultural change. And they're willing. They're all talking about it. They're interested. They need resources sometimes and help, but they're taking some of these issues on.
Okay, thank you very much. I am going to open it to the floor now because I know there's a lot of different groups of people in the audience, and I'm going to ask if you wouldn't mind by starting to introduce yourself just so that we can set your question in context. So who can we hear from first? The lady in the middle, and then I'll come to you, and then I'll come here. Sounds like there's a lot of questions, actually, so let's make them quick and answers quite quick, too. Thank you.
My name is Srila Flather. What I want to ask, which has been very much on my mind, is that right to family planning, right to contraception is not a human right. And I do very strongly believe that it should be a human right for a woman to be able to ask for family planning and to be entitled under UN mandate to have this right. And I think that with 5 people here who are knowledgeable and influential, I'd like to know what they're doing about this.
Thank you very much. Who's going to answer that question? Please, Tewodros.
Yeah, you know, that's one of the center of our campaign, for example, as far as IPPF is concerned. And after the FP 2020 summit, and then following the partnership with the Dutch government and UNFPA, we have put ICP plus 20, where we have mobilized over 120 civil society organizations which are working worldwide, and 1,300 civil society who are committed to that. And for us, what you call the pyramid of our operation is one of them is rights. Because if that is not taken as a human right, you can neither enable the person to get access for contraceptives and for information and education appropriate, and also to remove stigma from what is happening, and that the protection both to the provider and to the client. These are fundamental. And that's our campaign. Also during the CSW conference, during the CPD, the latest one, to create the enabling environment. And I'm very happy to report that we supported over 60 civil society organizations to be part of their country delegations, most of them from our side. They have worked day and night so that that right is recognized as a fundamental modus operandi of any development agenda. Because we are more than numbers. The soul needs a free spirit to make a decision, to enable for women to have a choice when and if they want to have children and the number of children that they want to have. Unless that fundamental right is respected, it can never be imposed. Otherwise, everything will be done in hiding, and that's going to have a consequence, a negative consequence on the health.
Thank you very much indeed for raising that question. Justine, do you want to address it as well? Or should we move on?
Yes, because I think it is important, and it is one of the areas where internationally we end up having a debate about something that we agree with you. We think it is about sexual and reproductive health rights. I think we have a fantastic chance as the successors to the Millennium Development Goals are debated to try and get the right sort of approach and language in that post-2015 development framework. And I think getting that right is absolutely critical, because we know from the original set of MDGs how galvanizing they were in terms of focusing attention and resources on areas of development work which were absolutely critical to get progress on. So certainly from our perspective as a government and as a country, we are always one of those advocating for rights for women, and in particular around sexual health.
Thank you very much. I promised the lady here in the white top.
Hello, hi, I'm Kath. I work in the UK for the NHS as a public health nurse, but I've also been volunteering with VSO in Nepal for 2 years, where I worked with a women's organisation. In Nepal, there's been a lot of improvements in maternal mortality, and women's groups have significantly helped with that. Women, when they have a voice in actual leadership positions at a local level and a national level, they're able to bring women's issues onto the agenda. So, for example, addressing things like child marriage or violence against women, and increasing women's rights to contraception. So I believe that when women have a voice in the decisions that affect their life, then that's only when we can see change. So I wanted to ask the panel if they agree with a target in order to increase women's participation in public and political life.
I don't think any of us are going to disagree with you, but if they dare, I'm sure you'll have something to say to them. Catherine, do you want to start with that, and then Melinda maybe?
Yes, I would like to say that midwives too are really very important in this issue, because we are the ones that can really advocate for women's rights in any environment we find ourselves, be it in the hospital, during our health talks. We strengthen all these issues, we educate them, and anywhere we come in contact with women and girls, we should be at the forefront to talk on this issue of their rights so that it can be enforced. And when women participate as well in political situation, with my wonderful women sitting down, they can really go a long way to also assist us in getting what we want regarding the rights of women and girls.
Absolutely. Melinda?
I would just say that I think you need to have women participating at all levels of society. And I don't think we're there yet, even in most developing nations, except if you look at the top countries in this area are really the Nordic countries. But you've got to have women across the spectrum so that we're both pulling women up and pushing them up from the bottom, and we're sponsoring and mentoring women. Because until you have enough women in leadership positions, in all kinds of positions, government positions, political positions, health ministers, private sector, we don't have enough women role models to be able to say there are 20 different styles of women's leadership, and I want to be like that one in government, or I want to be like this other personality who's over in this particular arena. We have lots of men's styles, but we don't have women's. And so I think you need women across the board. And I think that you also need women, as you said, women's groups coming together. One of the best things that have happened in HIV/AIDS is women's groups banding together. India is a particularly good example of this, to say, we demand services from the government. We have the right to services. Instead of stigmatizing, being stigmatized, we're going to go in and demand rights in the local health clinics and in the hospital. And that's how they finally got services. So it takes women across the board. Some of the most forward-thinking governments on this are like Paul Kagame's. I mean, he does have a target that he says, 40% of his parliamentarians are going to be women, and they have more than that. And he said, that's the way I want to repair my country after the genocide. And when you go to Rwanda these days, they have an extremely strong parliamentarian system, men and women. They've got an extremely strong health minister. So the three countries that have made the most progress in terms of lower income countries on childhood mortality, maternal mortality, and newborn mortality are, as you said, Nepal, and then Rwanda and Ethiopia. And so I think women do make a difference in this.
Thank you very much indeed for that question. I promise this lady in the front. Is there a microphone coming your way? Thank you. No, it's just, sorry, here first, and then I'll come back to you. Thank you.
Hi. I'm Chris Mosler. I'm a parent blogger, and I work with the blogging community for Save the Children. And we've been very concerned about the issue of newborn deaths. Obviously, that's hugely interesting to the parent blogging community, and 1 million babies dying on their first day of life. So I have a question for the Secretary of State, and I'd like you to tell us, please, whether you plan to attend the upcoming Partnership for Maternal, Newborn and Child Health meeting, and how the UK government will be making commitments in support of the Every Newborn Action Plan, specifically to ensure every woman has access to a life-saving midwife when they give birth, which all my readers and the people who write for me had. It's an issue hugely important to us.
Thank you very much for that question.
On the meeting that I think you're right in saying is in Toronto, I'm not able to get to that one, but the one that I will be at is in Senegal later on this year, where we'll be doing a really important stock take on how much progress we've made on family planning. We'll absolutely be supporting the action plan that is coming out. And as you can see, for us, this issue of newborn, maternal health and child health, investment in family planning is something that we've really championed as a government, and it sits alongside everything else we're now doing on women and girls, not just in DFID though, but in Foreign Office, where William Hague's doing a conference this month on preventing sexual violence in conflict. And I think what I had in mind when we looked at preparing for the Girls' Summit was I think this political momentum that we can bring to bear that doesn't just take what we're doing in DFID at the grassroots and the investment that we're putting in, and we're the first G8 country to have met our 0.7% commitment. I think we wanted to complement that with the most senior people in government, including our Prime Minister, talking and advocating about this internationally and trying to show a real lead from that perspective too, and backing up all the countries that are now really themselves taking these issues and pushing them. We want to help them get further faster.
Huge progress has already been made though, hasn't it? And we know the solutions, and so I guess that's the frustration, isn't it? That there just needs to be the commitment.
Correct.
Okay, hands going up everywhere. This lady here, and then I'm going to come to a man.
My name's Tara Cookson. I'm a Gates Cambridge scholar at the University of Cambridge, where I study the impacts on women of conditional cash transfer programs. Melinda, thank you for your comment on bringing men and boys into the equation. I think that they're often missing, and this makes a lot of responsibility on one half of the population. So I'm wondering, how can we get men and boys on board?
That's a really big and important question. Thank you very much indeed.
Well, I think you have a lot of supporters in this room to start with. And I think I'm so glad you brought this up, because often we talk about women and girls and we forget to talk about men and boys. I work with fantastic men. I have a son, you know, but I work with fantastic men in the science community in so many realms. And I absolutely agree. If you're going to get societal change, you have to have men and boys to be part of it, and supporting women in various roles, supporting girls, saying we believe in girls' education. So one of the places where I look out and I say, wow, we've done pretty well as a world. We have parity now for girls and boys in primary school, but in secondary school, the girls completely fall off. So getting men and women and boys and girls to say it's important to keep our girls in school through secondary school, whatever that's going to take. If it's conditional cash transfer, which some countries use, if it's working on child marriage in certain countries, because that's why they drop out, if it's making sure we make those investments, we all have to push these issues. And even in societies like the UK or the US or France or Germany, we have to have men, again, even in high-level roles, again, pulling women up and sponsoring women in jobs. One of the biggest sponsors that I have in my life is Warren Buffett. And I could name about 7 other women who he has made sure that they're at points in their career that they had the support that they needed. And to have somebody that has your back in a way like that is really incredibly huge. And I know a lot of other working women who feel like they have a man who helped them lift them up and get where they were. Because women often, in some of these cases, won't say, I'm ready for the next role, and it's somebody above who has to say, yes, you are, when 5 other men put their hand in the job and say, their hand up in the air and say, I'm ready for that role. So it takes all of us to move these issues forward, whether it's in the developing world or the developed world.
And I think the key to success is about how men and boys are part of the solution and framing it from that perspective. I think the real danger is you talk about men and boys as if it's part of the problem. Actually, they're part of the solution, and what we need to do, and some of the best champions are men and boys who go, well, I want my sister to have a totally different future. And so it's how we can pull them into this. And Melinda's right. They're half of the solution, absolutely. So we can't leave them out of our planning.
I can't leave the only man on this panel
Yeah,
out of this
just-
answer either. So.
For us, we have a program, called Men Engage, engaging men, not only in understanding, but also in a transforming way. Because if we just put them like, preachers or, then you are reaffirming the authority and the power that they have. I think there should be a challenging relationship in a positive and engaging way. So that has to start from school or out of school from young age, so that all the barriers. And one thing, I think the progress which has been made, Switzerland, it was in 1971 women were, allowed to vote. They were unable. The United States, it took 170 years after the democratic rights were promulgated for women to be able to vote. In the UK, it took almost 150 years. It doesn't mean it should take the same thing, but there should be really a full commitment from the education system, the media, the way it is presented. Because let's not forget the media, how presenting women, girls into the publicity and so on, that also shapes up the image of the younger generation. So I think it is a partnership of not just the politicians, but also the media group, which is important.
I'm aware of how quick our time is going. There's a question, not there's any pressure on you, but you are the first man to ask a question. And then I am going to go to, there's a media group over there. So the lady in the second row, I'll come to you next. Thank you.
Hello, my name's Daniel Gordon, and I was a VSO volunteer as well, actually in Kwara State, Nigeria. I've just got back a couple of weeks ago. I have to admit I feel kind of silly because that was almost exactly what I was going to ask.
Okay.
So if someone else would like to go.
That's really sweet of you. Thank you very much. Okay, there's a man in front of you in a suit with a nice tie on.
Well, I am a gynaecologist, sorry. Paul Fogarty from the Royal College of Obstetricians and Gynaecologists. I think I was so pleased to hear the range of items that have been discussed at this meeting, and I don't think anybody could not have been moved from Catherine's discussion of a baby dying from FGM. And this is just, it's overwhelming. Could I ask the panel to look over the horizon? There's great enthusiasm on the stage. What will happen in the post-2015? What would you consider a success? I want to keep maternal and child mortality at the top table. How do we get it there, and do you think it will be there next year?
Right, how do we measure our success? Thank you very much. Can we do that briefly, because there are so many people. Who's going to answer that?
I would say that if you have African nations 20 years from now so that they look like the UK in the sense that when a woman goes into the hospital to give birth to a baby, you don't expect her to die, you don't expect her baby to die. The numbers that are here in terms of the number of deaths of children and newborns and women, those should be the same numbers we expect in Africa, and it absolutely is possible. We can look out 20 years and look at the slope of the curve in under 5 mortality, and if we get the same slope of the curve on newborns, which we think we can cut the deaths by 2/3. And so those most African nations, not every one of them, but the vast majority could look like the UK looks in terms of health statistics for women and babies. To me, that's incredible.
Very quick. Actually, do you know what? I'm going to not ask for any answers on this one because there are just so many hands going up at this late. Sorry. The lady in the second row. Thank you, in the media corner.
Thank you. My name is Eliza. I work for The Guardian, specifically looking after a community for people who work in the development sector. So my question is really on behalf of them, because everything we've talked about here seems to put the ball firmly in the court of governments or the donors or the multilaterals. But small NGOs, grassroots NGOs, they're the ones putting bandages. They're the ones trying to train up, midwives and health workers. So what do you think their contribution needs to be to this very broad debate? What should they be doing to contribute to positive change? Thank you.
I think that's a very good question, because that was going to be my final one. So, yeah, essentially, there's a lot of people in this room and obviously around the world who really care about these issues and really want to campaign and do stuff. So what do we do?
What we do on the Girls' Summit is hopefully create that sort of social campaign that really taps into grassroots. And I think civil society has a key role to play here in actually making sure that change happens on the ground in a sustainable way. The danger is that you get change for a bit of time, a few years, and then people go back to doing, what they were doing before. And actually, I think that's where civil society can play such an important role, and also in tracking and monitoring and evaluation, all of that day-to-day stuff that is quite hard to do when you're Secretary of State for DFID, but actually I need civil society to really stay on the case.
Lady right at the back, blue jacket. Thank you.
I come from Cambridge too, but not part of the Gates Foundation. I head up a centre for looking at applied research on human trafficking, but I'm also a Cherie Blair mentor, working with some women in... There we go. Is that on now? I'm working as a mentor with the Cherie Blair Foundation. They also come from Cambridge on the Centre for Applied Research and Human Trafficking. But I want to look at that long tail of objectification of women, which we experience here in Europe and the UK. And we've recently had a bit of an example of it with the Premier League. Saying statements.
Can I ask you to get to your question?
My question is, how are we using the upcoming FIFA World Cup to front stage women and girls and what's happening at the summit?
That is called,
I know that's something that UN Women were talking with FIFA about, and I know that the head of UN Women, Fimzili, is really keen to use sport, and in particular football, as a way of raising the issue of violence against women and girls and getting men and boys involved in helping to combat that. And certainly for DFID, it's something we're also very interested in as well, perhaps with our own footballers here in the UK.
Yeah, very powerful tool. Sorry to rush you, but look at all these hands. A few more minutes left. Gentleman with a purple tie on.
Hello, John Notspeech from Murray Stopes International. Just very briefly, a sort of technical question in that where we work, particularly in Western Africa, is where so many of these issues we've been talking about are so prevalent, and yet it's where we struggle to find partners to do the work that we would like to do there. I wonder if the panel could, excuse me, comment on how we galvanize people to put some attention on West Africa.
Okay. Just go ahead.
So there's a partnership called the Ouagadougou Partnership that's based in West Africa, completely on family planning. It's focused on 7 African nations. The great thing since the Family Planning Summit is that we have costed family planning plans coming out of Africa. Senegal is becoming a role model for all of West Africa in terms of how to do innovation with the private and public sector on family planning. And I think some of the most innovative plans are doing things like creating a husband's school in Niger. Niger has a costed family planning plan for the first time that has a chance of getting funded because of FP 2020. And we're also seeing things like the imams in Senegal stepping forward and saying you can use our network to push out the message on family planning. So I'm seeing some pretty neat partnerships already forming in West Africa.
And Catherine, I'm sure that you would appreciate that too.
I want to say something again that in Nigeria, our President Goodluck Jonathan, is also a co-chairman to the life-saving consumables, including family planning consumables, being available in African countries. So we are also, we've keyed into making family planning commodities available and accessible to our population.
Thank you very much. I don't know where to go next. Here.
I'm a parent blogger with Save the Children as well. I have a particular interest in infant mortality. I would like to say we have an amazing NHS in this country. How are we helping other countries develop something similar to deliver services to women there?
Justine?
I think what's interesting about a lot of the work that's been done around healthcare, Gavi's a great example, is in a way it's ended up providing a backbone, if you like, for a broader series of health services to be bolted onto it. So I think once you started to work out how you get vaccination and the drugs in a stable state to somewhere that's very rural and it's still an active substance to be able to inject, once you've worked out all of that, once you've worked out how you get those skilled birth attendants and midwives and the training, you're starting to develop an organisation and a health system in a country that you can then bolt on the next thing to. So, for example, treating people with AIDS, and that's what we're seeing now starting to develop readily in a lot of these countries. And actually, I think we've made some big steps forward. And over time, what we're starting to say is, well, actually, if we can make all these progresses on malaria, on TB, on AIDS, why don't we start looking at other treatable diseases and adding those on too? So I think there is a lot of progress being made, but if you go to some of the larger countries, I was in China about a month ago, for them, the challenge of setting up anything close to the NHS is a massive, massive challenge because the scale that they're dealing with is so huge by comparison to the UK. So I think what we all need to do is get systems that work for us in our country and take the best bits and learn from countries like the UK that do have a very holistic approach to doing health. And it's fantastic to see some of our NHS staff being part of VSO, and indeed when we respond to humanitarian disasters like the Philippines, it was some of our NHS staff were the first out there helping to treat people on the ground. So we do have a wonderful health service, and it is one that DFID draws on both in terms of our experience but also occasionally its manpower.
About 2 minutes left. I'm going to this lady first, but please make it very quick. I'm going to go to one other question, and I don't know.
Thank you very much. I'm very encouraged. My name is Cecilia Annim from the Royal College of Nursing. Very encouraged with what I have heard. But what I need to say is that with all these efforts, we need to increase accessibility, because when women come to the clinic, it's not only for contraception, it is a point of care, so we make every contact count. So we need increased accessibility, please.
Absolutely right. I don't think there's an answer to that. I think we'll all agree with that. Thank you very much indeed. Lady right behind the camera, and you're going to be the last question, so I hope you're really good. Yeah, there's no pressure. It's you. Yep.
Good afternoon. I'm Fatima Kelleher. I'm a social development consultant who works in women's rights. When I worked in northern Nigeria a couple of years back on maternal health, there was quite a conflict of interest or a very contentious issue around the use of traditional birth attendants in family planning and maternal health programming. So I think this question really is mainly for Catherine, but anyone else as well. What are your views on this?
Thank you very much indeed. Catherine.
Yes. Actually, my view on traditional birth attendants is that these people are not really well skilled enough to attend to the women and their babies. I have been privileged to come across a baby, a woman who delivered. The traditional birth attendant succeeded in saving her life, but that baby had what we call meconium stained aspiration, and he was rushed to the bigger hospital. But that golden minute was already eroded. So it caused brain damage to this baby. We succeeded in making this baby to survive, but he could not live a quality life. So why do we, attend to people who can only give life that can be marred in future? So I will still keep on saying that midwives are the answer. If any community where people are interested to be trained as midwife, let's give them quality care. Okay. Let them serve their community.
Thank you very much. Just quickly, I'm going to ask for a very quick answer from all of you, perhaps starting with you, Catherine. There are thousands of people campaigning about these issues around the world. Many of them are in this room. Yes. What is your ask for all these people? What do you want them to do?
Yes, what I want us to do, because I feel so happy that we are all working towards the same cause. What I just want us to do is to join our voices together to campaign for all these harmful practices. We need more midwives who are skilled, well-motivated. Speak for us and let them know that midwives are still very, very important in all issues relating to women, girls, newborn, and children's rights.
Okay. Thank you very much.
I want male involvement, especially in African society. We cannot be promoting women's rights without involving our men. So please join the voices in speaking for us. Thank you.
Which cues up nicely the man to your right.
Yeah, yeah. The good thing is, some of us have turned it into a feminist. So, we care about our women, the girls, and that has to be a battle. Because as for me, my mother, she was forced to a marriage when she was 13. She was hiding. My grandmother took her. That's how she was saved. And it's her who gave me that life. And my commitment to a woman is not just philosophical, it's based on real life. Mm. One thing I want to appeal to all of us is that let's not take what we have for granted. The major challenge that we have is we take it for granted, and those who are opposed to us are more energetic than those of us who are committed. We have to unite. And for that, really, I want to commend also the parliamentarians. I can see Baroness Jenny and Richard. They are really, with the Parliamentarian Network on Family Planning and Population, they are doing a wonderful work, and we have to support our parliamentarians.
Thank you very much indeed. Justine, a big ask.
I think it's time to take a massive jump, have a massive jump forward in women's empowerment, women's rights on voice, choice and control. You're right. I think if you're not winning this battle, you're losing it. And in recent years, it's felt like we've had some incremental steps forward, but they've been, in a sense, too small. And it's now time to take that next massive step forward, and I want to try and help the Girls' Summit be part of how we do that. And 2014 should be a watershed year when we all get to the end of it and think, right, we have collectively decided that we're going to get a lot further, a lot faster, working with countries and supporting them. And actually, we shouldn't accept the status quo anymore. We've got to really make sure we have a ginormous step forward after July.
Thank you very much. Melinda.
I would just say, let's imagine a different future for women and girls than we have today. It's in our hands. We're on the cusp of that. We've done a lot of great things. But let's imagine a future where women and girls don't die. And let's imagine a future where women and girls are empowered and have agency. I met a woman in the developing world, and a beautiful woman named Marianne, and she was holding a little baby, and she said to me, I want every good thing for this child before I have another one. And what I would say to you all is, let's imagine every good thing for children and for girls and for women.
Very well said. Thank you very much. Well, I would just like to say I have never chaired a panel session where the audience is so eager to ask questions. So I think that kind of suggests that we're onto something, don't you? So we should all probably feel quite optimistic, and we should probably do this again, don't you think? Thank you once again to all of our panelists and for all of your time. Thank you so much. Thank you.